Taking good care of our aging population is going to take some creative thinking. Thankfully, some design students are already on it.
As Linda Aylesworth reports, one long-term caregiver has teamed up with students from Emily Carr to make hospital rooms more livable and functional.
Okay, how does that look, Eilish?
They are design students from the Emily Carr University of Art, and they've been asked by Providence Health Care to make a few changes around the Brock Farney long-term residence.
So the problem here we were trying to solve with design is take what essentially is an institution and turn it into something more like a home for residents.
Their goal is not only to make it more homey, but more functional for residents coping with things like memory loss.
A number of our residents might have difficulty finding their rooms, their homes, and so we're trying to find ways to make that as easy for them as possible.
One solution, instead of every doorway looking the same, mix it up.
If we make the rooms different, if every room had a different texture or a different color or a different mailbox or photographs of the resident, it would be simpler to navigate.
They're taking my picture. What for? I have no idea.
They have chosen Douglas's door as a prototype.
So I'm just a handsome guy, that's all.
This is an opportunity to test this prototype, to work with our residents and our families and our staff to understand what does work, doesn't work.
Brainstorming sessions have already been held to gather ideas in creative ways. As a result, they've learned about some problems, like what happens if you have to get up in the middle of the night.
The light in here, in this room, is all controlled by one switch. So when one patient wants to go to one resident wants to go to the washroom, every single light has to be turned on.
So Michael is installing light strips under the bed and in the washroom, which when activated by a motion detector will softly illuminate the way.
I love it. I love to help, kind of just help them improve their life in general. That's, for me, yeah, most rewarding.
For creative problem solvers like Michael, health design, as it's called, is a perfect fit. What he and the other students come up with may be used not only to make Providence's 5 existing residential care sites better, but be used to design future facilities. Linda Aylesworth, Global News.